to another episode of Graceful Touch Speaks Out, where we get the limelight the of the community of health and wellness, finding out where people are passionate about and what they want the world to know about wellness. Today we have with us uh, Eva Z Wellness. And like she was just saying, pronouncing her last name is a little bit of a challenge, so I'll let her do that. But let me bring her in, and we're going to be talking today about finding a focus for chronic pain, chronic illness, and mobility issues. One moment here. Eva, welcome to the call.
Hi, Guy. Thank you for
Awesome.
having me.
Awesome. Glad to have you here. So I already feel a little bit of your energy from our pre-talk and whatnot. That you're slightly motivated in this direction of wellness and whatnot. Am I correct?
Just a little bit. Yep.
So why?
Well, a couple reasons. First, I was diagnosed with scoliosis when I was 12 years old. So I
Okay,
have been living with chronic pain since I was 12.
sure.
Uh, and I never really fully understood it. I didn't understand why it was that it hurt in my body when I did certain things. And the other reason that I'm really passionate about this is I've been in the medical field for over 20 years. I've been an ICU nurse, I've worked in different hospitals, and seeing how pain affects not just a person, but also their family and their quality of life. It's very near and dear to me because of the influence of others on me. And then about 5 years ago, I started seeking out becoming a yoga teacher, which led me down a whole other road. And in that process, I started seeing and working with people and seeing how, when I was able to show different ways to add movement and breath into their daily habits, I was seeing some really profound results, and it led me into a whole different direction in terms of my career and my profession. And so now I'm a mind body specialist, and
Awesome.
I focus on helping people with
Awesome.
pain and
Awesome.
chronic illness.
So let's stop there and just kind of dig into what you just said here a little bit. But before I do that, if you are viewing the presentation here and you have any questions, just put those in the chat, and I'd be glad to ask Eva about the questions as they come about. But so what I understand from what you said there, Eva, is you had a personal uh, part, a motivational part, even from age 13. There, that the whole idea of getting out of chronic pain became a real event, a real motivation for you personally. But along with that process, you chose a career in the medical area and moving through the medical field in the process. So you've got a career aspect, you've got a personal aspect, and then you start getting into this yoga and learning dynamics and whatnot, which was kind of a third leg into the whole process. And all right, so what did that aspect bring forward for you? That bringing all three of them together, that produced what?
So I refer to myself as a mind body specialist. And the reason for that is because there, and you know this in your work as well too, in the medical field, there's long been a disconnect
Mm,
between what happens in the mind and what happens in the body. And I don't know when or where that exactly started to happen, but one of the really cool things is that now we're starting to see that being unlearned. You're starting to see more of that being brought into family practice, into the medical practice. And we're looking at not just the pharmacological and the intervention basis, but now we're starting to look at what can you do in your daily life? What are the things that you can eat, the ways that you can move, how can you breathe, how do you sleep, the quality of your sleep, and looking at all of those components to be able to say what's working for you and what's working against you. And one of the things that, as I started in my journey, I started as a yoga teacher, I ended as a yoga therapist. So I'm an adaptive yoga therapist. And one of the reasons that I went that route.
I'll pause you for
Yep,
just a minute.
go ahead.
What's the difference? Because to me, you just said the same thing. So there's obviously a difference. What's the difference between a teacher and a therapist?
So a yoga teacher goes through either a 200 or a 500 hour education to be certified as a yoga teacher. A yoga therapist starts there and then adds a whole other 500 targeted hours. Actually, it's 800 targeted hours specifically on mind body integration. So, how to take.
Like clinical?
Say that again?
Kind of like clinical?
Exactly. So a yoga therapist can write a treatment plan specific to a person that incorporates mindfulness, movement, breathing, and it's targeted specifically to the person rather than the checklist protocol that happens in a lot of allopathic medicine.
Got it. All right. So you started with a teacher, ended as a therapist. And how long ago was that?
So that whole process has been going on over the last 5 years. I've been working with clients individually since 2018. And my whole focus has been on adaptive yoga therapy because I'm not a bendy person. There are some days
So
that.
just so we fully understand, what does the word adaptive mean?
Well, for some folks, when they think of yoga, they think of I must be incredibly flexible and I must be able to move myself in certain ways into certain poses. And adaptive is taking the yoga and making it fit the person rather than trying to take the person and make them fit into the yoga. So I always say that I can work with anybody, whether they are incredibly bendy or whether they are bedbound,
And
because
if you have scoliosis, which you did at age 13, right? So
mhm,
you're going to have problems. You're going to have difficulty with the whole bending concept in the first place. So
exactly.
my wife, for example, is a massage therapist. She has back pain because of an accident that she was in. So I have always said that I feel like she has a leg up on me. We're both we own Graceful Touch Massage Therapy in Rapid City, but she has a leg up on me because she's got the experiential knowledge. I don't. I don't have back pain. I don't have body pain. Um, and that really does make a difference.
Yes, and part of my work is not just in working individually with clients, but also in working with yoga teachers and with nurses and educating on what does what does yoga do? What does mind body integration do? And part of my trainings includes, what does it feel like to have a body that doesn't listen to the commands the way that it does for a person not living with chronic pain, or not living with an autoimmune disorder, or whatever the situation is that prevents a person from having full access to all of the different movements and energy that someone not living with those conditions has access to on a regular basis. And for folks that are not bendy like I am, it's different when you're taking a class and someone gives you 7 different options on how to do a particular movement, versus another person who may say, well, you can do this or you can do this.
Mm-hmm.
Because in their body, they have access to both. So, and it's not to say that, yoga teachers that are bendy aren't good teachers. That's not what I'm saying at all. But when you have to challenge your brain all the time as to how you can move, how when certain days just standing up is a chore, bending down to pick up something off the floor, there's many days where I drop something on the floor and I look down and just think, well, I guess it's staying there for a while.
Right.
Because that's the only option. And part of that flexibility is in our mind as well too. Because when you're living in a body that has pain, sometimes there's certain things that you just have to let go of in terms of being able to navigate your daily existence.
So that's very well said. And what I think I hear from this is you're basically making building a platform for everyone to feel like they belong.
Absolutely. And one of my biggest passions is in helping people to recognize and utilize the benefits of yoga, because it can happen anywhere. It can happen at any time. Whether you're dealing with pain, whether it's PTSD, whether you're working with an autoimmune, you're living with an autoimmune disorder, there's a lot of challenges to just being able to live our daily life. And the more we can do that with kindness and compassion and non-judgment, and use that basis to make choices in our daily life that are helping us to live a life that has less pain, and to be able to enjoy the things that really make our heart sing.
Awesome. Awesome.
Whether that's being outside, or whether it's being able to sit down on the floor with your children or grandchildren, how do you participate in your own life in a way that fills your cup?
I was thinking, as I was preparing for this call today, dealing with chronic pain, chronic illness, and mobility, I was thinking, if I was being interviewed about massage, what would be a pivotal theme that I would want people to, that people really don't understand a lot about massage? And for me, that answer is they don't understand the true value of massage. And a lot of people just see it as, it's a nice thing to do. So I'm going to turn that question to you. What is it that you feel like within what you do that you wish, if people only understood this?
Yes. Oh, so in the things that I do, I wish more people understood the value of listening to their body and trusting in what they hear.
Mm.
And
I'm going to
one of the
repeat that, 'cause that was so cute. That was so cool. The key focus, the value of listening to the body and hearing what it says. Is that what you said?
Yes, yeah, being able to engage in the physiological conversation that's
Mm.
happening within you. Uh, and it's interesting because
Okay, so I'm going
I
to
have a
stop you.
bachelor's.
I'm going to stop you
Oh,
again because we used another big word. And I just want to make sure people understand what is physiological.
so physiological is the processes that are happening inside of your body. So it's being
Aging?
able to tune into, um, do I have, what are the sounds and sensations that are happening inside of my body? Is there a pain? Is there a muscle that's kind of being pulled a little
Mm.
bit? Am I, what's the quality of my breathing? What's the quality of my mind? Am I hungry? Am I, what's the quality of my intestinal system at the moment? Is it happy? Is it full? Is it saying I need to release? And it's all of those things that are going on all at the same time,
Mm.
and being able to tune into what's happening inside of my particular body in this moment, so that I can make decisions that are helping me. So I have more energy, I'm sleeping better, I'm moving better, I'm in a better mood, so that I'm interacting with family and friends as, the happy, healthy version of myself instead of the cranky, pissy version of myself.
Right, right. Now, I know when I interrupted you there, you were in the process of going into why understanding what the body is saying is important, and then I kind of interrupted you when you were going into the process. Did we just cover that within the angry versus pissy type situation?
We did. The one thing that I was going to add is that, in my background, I've got a degree in physiology, I have my nursing degree, and it was in all of my yoga therapy training where I really learned how to apply all of these things. And in my research and talking with other medical professionals, I ask constantly, is this being taught to new nurses? Is this being utilized in your area of practice? And the answer is always no.
Mm.
And
So
it's,
did you just basically say that within nursing physiology, it's more targeted to book learning and rote learning, whereas in yoga, it's more targeted to practicum?
uh, not quite. It's more that in the medical system, we're looking at reactive.
Mm.
So, it's targeting on, you have an issue, what do we do about it? You have a symptom, how do we treat the symptom? Versus, and we are, the medical system is changing. You're getting more functional medicine, you're getting more holistic uh, practitioners, and so that is starting to change. There's a lot that's happening at Harvard Medical that's really integrating the mind body connection into medicine. But in terms of, you feel anxious, what are things that you can do? Those practices aren't being utilized as much, and it was interesting when I really tapped into this, when I really started to learn more of these things, because those were things that I was using with my patients before I did my yoga therapy training, and not really not knowing that I was already doing those things. So, as I'm inserting an IV into a person, I'm walking them through breathing as I'm doing the process to help them to feel more calm, to be more relaxed. Because a lot of times folks don't realize that when they're tight and they're tense, that when they hold their breath, they squeeze their muscles even tighter, and it makes inserting an IV that much more difficult. So I was using those practices, and I know there's a lot of nurses that have been using those practices as well. But being able to work with someone and have their breathing help them through pain, where maybe they needed less pain medication, or they heard the sensations earlier and they were able to do some changes in how they were moving, or they were able to use practices that they knew worked for them specifically, so that they were able to not need their pain medication. Because, I mean, we know every single medication has side effects. So it's not trying to replace the medical system, it's working with the medical system,
Mm,
so
okay.
that, if somebody needs pain medicine, they recognize when it's starting to get worse, so they're utilizing their pain medicine early, so that they're still able to maintain that same level of functioning in their day. Or they're able to do some interventions that help them to need less pain medication, or to not need it at all, and to save it for a more severe episode of whatever it is that causes them to have pain.
So let me see if I can sum this up in a better way, since I missed the mark last time. More proactive rather than reactive.
Yes.
Aw-
Yes.
Awesome. Awesome.
Yes.
So
And oh, go
go
ahead.
ahead. No, you go ahead.
Oh, I was just going to say, and this is also about the biggest thing is improving quality of life.
Mm,
So a lot of times, and I know this was me for a long time, is not putting together, not connecting the dots in terms of the things that I did on a daily basis, and just how much they impact how I feel and how I'm able to move in my body.
got it. So, this journey has taken you from 13 to now. My guess is you're not 13.
No, I've got a few more decades added on to the
Okay,
birthday candles.
there you go. But what about the decades ahead? Where do you want to take this as you move forward?
Every time I see somebody in their 80s or 90s that is participating in an Ironman, or running in different events, that, they're able to maintain their quality of life, so that they're able to do all of the things that make them happy, being able to connect with their family, connect with their friends. It inspires me to want to do all of the things so that I can in turn have that same level of functioning later on in life. I want to be 90 something years old and still hiking through mountains, and um, teaching yoga classes, and helping people to be able to decrease their pain and have more quality in their life, to be able to sleep better, to have more energy. Those are the things that really just I absolutely love hearing when my clients say, I didn't need to use as much pain medicine, or I started the series and I had a lot of pain and it's gone down with every session that we've had together. Um, because in the end, it's not about how much time they're spending with us. It's how much time are they out in their life enjoying their life.
Awesome.
And if you've got pain and you're not able to get out of bed, or you're not able to get out of your house because it hurts to move, then you're not doing the things that make you happy. You're not doing the things that make your heart sing. And in the end, that's really what matters, is how much are you doing in your life that you're happy with, that
Awesome.
brings you happiness. Yeah.
Sure. So, we've heard a lot about your background, your future, where you're at, your passion, and whatnot. But I have one question that I'm still unknown on, and that is, why take the last 30 minutes to spend with me? What is it that you're wanting? How is it that you feel empowered that this is going to be something you want to do? What is your goal, your desire, your purpose from this conversation?
Oh, the more people that understand how being connected with their body can influence the quality of their life, that it is important to pay attention to the sounds and the sensations that are happening inside of your body. You don't have to be perfect. Nobody is saying that you have to eat spinach at every meal and you have to do yoga practices. Uh, it should be tailored specifically to each individual. And the more
So
people that understand this, the happier all of our interactions will be with each other.
awesome. So I want to take the other side of the coin there, and you mentioned you don't have to eat spinach at every meal. Well, as a naturopathic vegan, I prefer to eat spinach at every meal. So, there's the other side of the coin too. And it says, if you want to eat spinach at every meal, that's okay too.
Absolutely, absolutely. I think where a lot of folks get hung up is in that, well, I started this practice and it was too difficult because I didn't like the all of the foods that were on this specific list of foods that I should eat, or I did this workout but I missed one day because my schedule was crazy and I couldn't do it, so then I didn't go back the next day and finish the workout program. If we gave ourselves permission to not be perfect, and instead to just focus on showing up as much as we can every day, or if I skip a day, then giving myself compassion and saying it's okay, I'll just start back up tomorrow. It's in that where it doesn't have to be perfect. Do I love when people are saying I eat more vegetables and I eat more fruit and I drink less soda and eat less fast food? That is fantastic. The flip side of that coin is, if you're doing the best that you can and your best is to get your salads from fast food places, well, that's better than, you know, other alternatives. So
Well,
everybody's got to go at their own pace.
it's interesting that you just brought in fast food, because as you were, explaining that and everything, and giving yourself the ability to, have a break, or you maybe not be completely successful. I started thinking of this slogan that is pretty much in our lives, in our faces today, and that is, oh, let's see if I can remember it. You deserve a yeah, right. Now, we don't need to go there necessarily, but what we can do is we can take that slogan forward, and we can utilize that within our own processes. If you're not perfect within a process, at least this is what I think you're saying, give yourself that break that you deserve.
Yes. Yes, yes, yes. I always joke with my clients. I'm like, I love a good cheesecake. I don't eat dairy. I'm plant-based. about 98% of the time. And I don't eat dairy because dairy and I are no longer friends. But if there's a really good cheesecake, it's a good quality cheesecake and it's really yummy, I'm going to have a few bites of the cheesecake, even though I know that tomorrow I am not going to be happy and my body is not going to be happy. But if it was worthwhile in that moment, then I'm going to enjoy it and I'm going to savor it. And then tomorrow, when my joints hurt and my intestines are kind of yelling at me, I will just say, but it was okay. We're not going to be eating that again for a while, but it was worth it at the time.
You know, just to put a thought out here, a hot tip is there are vegan cheesecakes.
There are, and I have been playing with that and finding the alternatives. There's a vegan bakery that's only a few blocks from my house that I absolutely love. And
Yeah.
so it's yeah, we've been plant-based for several years, and it's amazing the amount of changes that I have felt in my body through that process. So yeah,
Absolutely.
all about
So,
the fruits and veggies.
so Eva, who is your ideal client to speak with? Who do you want to reach? Not that you don't want to reach other people too, but if you could only reach one person, who would that person be?
My heart is with nurses because I understand the amount of pain and suffering that nurses have been going through, not just in the past 3 years, but really for a long period of time. And I know that nurses went into this profession because they wanted to help people. And slowly, the longer they've been in the profession, the less they're taking care of themselves and the more they're putting everybody else in the priority versus themselves. And I would love to work with nurses that have been exhausted, overwhelmed. Their body is just feeling beat down from the years of working at the bedside, and that's where my heart is right now, is to be able to help them to take back that ownership of their life and their body and to feel more joy and to feel more fluidity in not just how they move, but also how they think, and to wake up with energy and vitality and feeling rested, which, you know, if you've been in the medical profession, you're listening to all of that going, wait, what?
Right, right, right. So, how would nurses or anyone get in touch with you?
I am on social at Eva Z Wellness on Facebook and Instagram. They can reach out to me either on those platforms or visit my website, evazwellness.com, and sign up for weekly tips and tools on how they can improve the things that they're doing in their life.
And that's Eva, EVAZZEE, Wellness.
Yes.
Eva Z Wellness. Instagram, Facebook. What else did you say again?
Instagram, Facebook, and then I also have my website, and then I'm on YouTube as well.
And with Eva Z Wellness?
Correct. Yes.
So you're branding yourself very well. Good job.
Well, thank you.
And then your website is also evazwellness.com.
Correct.
Awesome. Awesome. As it relates to social, is there a preferred social, or you're good as long as you connect via Insta or Facebook, you're good?
Absolutely. Yep.
Awesome.
I'm on both of those platforms quite a bit.
Awesome. 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 Well, I want to, number one, say thank you for coming to the call today. Now, what I'm going to do at this point is I'm going to put you on hold for just a minute, and then I'm going to bring you back, and I'm going to ask you, one takeaway from today's call. What would you want that to be? Be right back with you. All right. Well, I am Guy Severson of Graceful Touch Massage Therapy here in Rapid City, South Dakota. And you can get a hold of us for massage purposes at gracefultouch.org or calling 605-574-1998. Or if you want to check out any of our wellness products, that would be at gracefultouchproduct.org. That again is gracefultouchproducts.org, where we have over 50 different naturopathic products, oils, and creams meant to help people fight what people are fighting today. You can also get a hold of us at Instagram. That is my key. That's my focus is Instagram. Pain Relief, the number 4, the letter U. That's where I'm building momentum mainly. Pain Relief for you. Now let's bring Eva back and have her share with us some final thoughts or a final takeaway that if you didn't get anything else from today's call, you got this. Let's bring her back. Eva, welcome back.
Thanks, Guy.
Awesome. So final takeaway. I listened to this entire call. I enjoyed this entire call. What, if only one thing, would you want me to take with me into my life ahead?
Any movement that you're doing is beneficial to you. So whether it's yoga, whether it's walking, whether it's running, whether it's cycling, any movement that you're doing where you feel good afterwards, do that movement. And always be able to look into how your body responds and to trust in what you hear from your body to inform how you make your choices throughout your day and throughout your week.
Awesome. Well, thank you, Eva. I just wanted to say one more time, thank you for coming and spending time with me today. You gave a plethora of knowledge, and I have a feeling we only got a little tiny sliver of that cheesecake.
Yes,
Oh,
yes,
well,
absolutely.
So I'm going to put you on hold one more time and finalize, and I'll be back with you in just a moment.
All right, thanks.
Okay, so you can catch the Graceful Touch Speaks Out live at 1 o'clock p.m. Mountain Time. There are some other times that we do as well, but the main focus is 1 o'clock p.m. Mountain Time. And we will see you tomorrow. By the way, that's Monday through Friday. We'll see you tomorrow, and we look forward to it. Take care.